Coronary artery disease killed 371,000 people in the United States in 2022. And for many of them, the very first symptom was a heart attack. If you've just been told you have coronary artery disease, you're probably feeling two things right now: scared and overwhelmed. Your doctor may have thrown around words like plaque, blockage, statin, maybe even surgery. You walked out of that office with a head full of noise and no clear picture of what happens next. So let me slow this down for you. Because a diagnosis of coronary artery disease is serious, but it is not a death sentence. Not even close. Here is what it means in plain language. Your coronary arteries, the ones that feed blood to your heart, have plaque building up inside them, narrowing the passageway. Your heart is getting less blood than it needs. You may not erase the plaque that is already there, but you can slow it, stabilize it, and in some cases, reduce further progression. And what you do starting today changes everything. I'm going to walk you through the 5 things that matter most right now. And the last one is the one most people skip, even though it might be the most important of all. Step 1, take your medications every single day. If your doctor prescribed a statin, a blood pressure medication, a blood thinner, or aspirin, take it every day. But here's what most people get wrong. They think these medications are just managing symptoms. They're not. The dangerous part of plaque is not just blockage, it is rupture. A statin doesn't just lower your cholesterol number. It actually stabilizes the plaque sitting inside your arteries, making it less likely to crack open and trigger a clot. Blood pressure medications reduce the force pounding against those artery walls every second of every day. Blood thinners help prevent clots from forming at the site of narrow spots. These drugs are doing invisible work inside your body. You won't feel it, but they are the reason many people with coronary artery disease live full, normal lives for decades after their diagnosis. If the side effects bother you, tell your doctor. There are almost always alternatives, but do not stop on your own. Step 2, move your body. This is the part many patients accidentally ignore because fear talks them out of it. Exercise might be the last thing you feel like doing after a diagnosis like this. You might even be afraid that pushing yourself could trigger a heart attack. But here is the truth. Sitting still is more dangerous than moving. Physical activity strengthens your heart muscle, improves blood flow, lowers blood pressure, and helps your body manage cholesterol and blood sugar on its own. And here is something most people never hear. Your heart can actually build its own backup routes. When you exercise regularly, your body starts growing tiny new blood vessels around the blocked areas. Doctors call this collateral circulation. The more consistently you move, the more of these small pathways develop, and the more blood gets through to the parts of your heart that need it. You don't need to run marathons. Walk. Start with 10 minutes a day if that's all you can do. Build to 30 minutes most days of the week. Swimming, biking, even gardening. Anything that gets your heart rate up gently. Ask your doctor about cardiac rehab. It's a supervised exercise program designed specifically for people with heart disease. You're monitored while you exercise. You learn your limits, and you build confidence that your heart can handle more than you think. And this next step may matter more than you think because nobody tells you exactly what to eat and what to stop eating. Step 3, change what's on your plate. Here is the way to think about it. Every meal is either feeding plaque growth or helping calm the artery wall. That is the choice you're making 3 times a day, whether you realize it or not. Cut back hard on fried food, processed meat, fast food, and anything with a long ingredient list full of things you can't pronounce. Some of the worst damage comes from foods people eat every day without thinking. These foods drive up the kind of cholesterol that feeds plaque growth. Add more vegetables, fruits, whole grains, beans, nuts, and fish, especially fatty fish like salmon or sardines. These foods lower inflammation and improve your cholesterol balance from the inside. Watch your salt. Excess salt raises blood pressure, and high blood pressure is the #1 force that damages artery walls and accelerates plaque buildup. The recommended limit is under 2,300 milligrams a day. Most people eat nearly double that without realizing it. You don't have to change everything overnight. Swap one meal at a time, one habit at a time. Small shifts that you can actually maintain will do more than a dramatic overhaul you abandon in 2 weeks. Step 4. Know your numbers. This one sounds boring, but your numbers often worsen quietly before your symptoms ever do. That is why this step can save your life before you even feel anything wrong. From now on, there are 4 numbers you need to track, like your life depends on them, because it does. Your blood pressure, your LDL cholesterol, that's the one that feeds plaque, your blood sugar, and your weight. Don't just ask your doctor if these numbers are fine. Ask what the exact number is. Write it down. Ask what it should be, and ask what you're doing to get there. When you track these numbers over time, you see the progress. You see the medications working. You see the diet changes making a difference. That feedback loop keeps you going when motivation fades. Step 5. Deal with the fear. This is the one nobody talks about, and skipping it can undo all the other steps. After a diagnosis like this, fear moves in. You start wondering if every twinge in your chest is the start of something. You lie awake at night. You're afraid to exercise, afraid to travel, afraid to live the way you used to. That fear is normal. But stress does not just affect your mind. It can push heart disease harder. Stress and anxiety raise your blood pressure. They increase inflammation. They flood your body with hormones that make your heart work harder. The emotional weight of this diagnosis, if you don't deal with it, can actually make the disease worse. Talk to someone, your partner, a friend, a counselor. Ask your doctor about cardiac rehab. It's not just exercise. It includes emotional support and education that helps you feel in control again. You are not the first person to hear this diagnosis. Millions of people are living with coronary artery disease right now, working, traveling, playing with their grandchildren, doing everything they did before. The ones who do best are not the ones who got the mildest diagnosis. They're the ones who took action. So here's the short version. Take your medications. Every day, no exceptions. Move your body. Even a little is better than none. Clean up your plate. You don't need perfection. You need consistency. Track your numbers. Know exactly where you stand. And deal with the fear, because your mental health is part of your heart health. Coronary artery disease does not define your future in one moment. What shapes your future is what you repeat every day after the diagnosis. Share this with someone who just got this diagnosis and doesn't know where to start. Sometimes one video is all it takes to turn panic into a plan.